Significant progress is being made to expand access to behavioral health services across Florida and train the next generation of professionals in the field. And while lawmakers are making significant investments, the truth is we don't know how much is enough.
Our Stephanie Valderrama joins us live in studio now with more. Steph?
Yes, good morning, Matt and Sam. So every expert that I spoke to kind of said the same thing. They said Florida is headed in the right direction, but the need for mental health services is growing. And right now, there simply aren't enough trained therapists or facilities available to meet the demand.
Behind barbed wire in a maximum security prison sit dozens of inmates suffering from severe behavioral problems, doing times for crimes which might have been prevented with access to the right treatment and medication.
Having mentally ill people in a jail is almost a human rights issue. They don't belong in jail.
But Martin County Sheriff William Snyder tells CBS 12 News they don't belong on the streets either. He says about a third of the inmates in his 700-bed jail have mental issues, and nurses give them medication multiple times a day. While his constitutional duty is to keep the county safe, his moral responsibility drives him to search for better ways to serve these men and prevent them from ending up back here.
So we have hired somebody at taxpayer expense to monitor them as they leave, to make sure that if they're entitled to Medicare, Medicaid, they're back on it, that if they're on medication, that they have follow-up care. And then we follow up with them with
breaking the cycle, making sure they get medication and counseling means his deputies aren't arresting the same people over and over again. But Sheriff Snyder has proposed a better solution, a mental health wing, where inmates can serve their sentence in a setting better suited to meet their needs.
What I have to do is, by classification, keep my mentally ill inmates away from the rest of the population for several reasons. They can be violent and hurt my other inmates, or the other inmates can perceive that they're weak and take advantage of them.
The Martin County Jail is a microcosm of Florida's struggle with treating behavioral health. With limited bed space in both private and public clinics, too many times people suffering without treatment end up behind bars or dead. Like Roman Phelps, a former student who crashed his van through the front gate of Dreyfus School of the Arts and was killed in a confrontation with police. Family and friends had tried to get him checked into a behavioral health unit, but their attempts failed. And just a couple of weeks ago, a mentally ill man with multiple arrests tried to get on campus at Suncoast High School and attacked a police officer before being shot twice in the school driveway just as kids were arriving for class.
There are estimates that go up to that 1 in 4 people have some form of mental illness throughout their lives.
Dr. Ryan Wagner, the chair of the Psychiatric and Behavioral Neuroscience Department at the University of South Florida, tells me not all of those illnesses are severe or even permanent, but those that are require inpatient long-term care, and there's just not enough to go around.
Anytime that we start a new service or we start to bring in a new provider or anything like that, that person can get filled very, very quickly because there's so much demand for mental health services.
Mental health problems cover a broad spectrum. Some are simple stress from work, school, relationships, social media, even watching the news. Some comes from abusing drugs or alcohol, often in an attempt to cope with stress or trauma. Now, over time, without treatment, all of those can become much more serious, and that doesn't even include those souls who are born with mental and behavioral problems. The state is at a tipping point in addressing the mental health needs of our population now and in the future, and lawmakers are taking note.
By conservative estimates, Florida has probably 500 to 700,000 of our constituents, friends, neighbors that suffer from some form of mental illness.
Florida Senator Jim Boyd was the driving force behind the Behavioral Health Teachings Hospital bill signed into law by the governor this year. As soon as July, $300 million will be invested in training the next generation of behavioral health workers. It will be a partnership between these hospitals and the University of Florida, University of South Florida, and University of Miami. But there's another important component of this law.
Do we have enough social workers? Do we have enough mental health counselors? Do we have enough psychiatrists? All of those disciplines, we just don't know.
Dr. Julie Sarovich is the dean of the College of Behavioral and Community Service at USF. Now it's their job to track the number of behavioral health care workers and the number of available beds at treatment centers statewide, and to report those numbers to Tallahassee. Now, in order to meet the need, you have to have an accurate read of what the needs are. And to her, that's the easy part. The most challenging task, she says, is keeping those currently in the field on the job while they train the next generation. Because it's difficult work, and burnout is the #1 reason people leave.
We're tasked also to be a little creative about this. That, yes, we need masters prepared, licensable therapists. We need PhD level prepared. We need MDs. We need all of that. But we can also find ways of utilizing even those in the undergraduate degrees.
Well, there is a lot to unpack on the topic of mental health, which is why we're focusing on it all day today. Now, everyone I spoke to agrees Florida is doing the right things. However, hundreds of millions of dollars doesn't do much to address the problem right now because people need to be trained and facilities need to be built. So a lot of work yet to be done.